Welcome to The Explainer. Today, we are decoding a true medical emergency, a condition where every single second counts: sepsis. And here's the thing that might surprise you. It's not the infection itself that's often the killer, but the body's own chaotic, catastrophic response to it. So we're going to break down what sepsis really is, how doctors fight back in those critical first hours, and what that long road to recovery actually looks like. So, here's our game plan. We're basically going to follow the patient's entire journey. We'll start with the basics, what even is sepsis, then move into how we spot it, the life-saving treatments, and then all the way through to what happens after the hospital and how the whole healthcare system is tackling this problem. Okay, let's dive right in. Before you can fight an enemy, you have to know what it is, right? And with sepsis, the enemy isn't just some invading bacteria or virus. The real problem is us. It's our own body's response getting out of control. And that question, right there, is the whole story of sepsis. Normally, your immune system is your protector. But what happens when that protector turns on you? Think of it like a case of massive, body-wide friendly fire. So here's the official, modern definition. And the most important word on this entire slide is dysregulated. Your immune system should be a precise, controlled army. In sepsis, that army just goes completely rogue. It unleashes widespread, uncontrolled inflammation that starts damaging your own tissues and organs. To figure out how bad the damage is, clinicians use a tool called the SOFA score, which basically adds up points for how poorly different organs are working. Now, this is a really critical distinction to make. Sepsis is bad, but septic shock is its most deadly form. With sepsis, you have organ dysfunction, but in septic shock, the body's entire circulatory system is starting to collapse. The blood pressure tanks, and, this is key, it doesn't come back up even when you pump the patient full of IV fluids. That's when you have to bring out the big guns, drugs called vasopressors that literally squeeze the blood vessels to keep blood pressure up and get oxygen to those vital organs. Okay, so we know what we're looking for. Now let's talk about the single most important factor for survival: speed. With sepsis, there's no exaggeration in saying that this is a flat-out race against time. So, what are doctors and nurses on the lookout for? Well, it's not just one thing. It's a whole constellation of signs. Someone suddenly getting confused, breathing really fast, having low blood pressure. Those are huge red flags. Other clues, like blotchy skin or a high lactate level in the blood, tell us that the body's tissues just aren't getting enough oxygen. That's a state called hypoperfusion, and it's a very bad sign. Now, to spot these red flags in a chaotic emergency room, hospitals use standardized screening tools. Think of them as early warning systems. The Q-SOFA, for example, is a super simple 3-point checklist you can do right at the bedside in seconds. News is a bit more comprehensive. These tools don't diagnose sepsis by themselves, but what they do is scream, "Hey, you need to pay very close attention to this patient right now." And all of this feeds into a really clear clinical workflow. It all starts with just having a high level of suspicion. From there, you use a rapid screening tool. If that's positive, you move to confirm with lab tests. And, critically, at the exact same time, you're starting the detective work, drawing blood cultures to figure out what bug is causing the problem, and using X-rays or CT scans to find out where in the body the infection is hiding. Okay, so sepsis has been recognized. The diagnosis is made. Now the clock is really ticking. It's all about stabilizing the patient and getting blood flow back to those organs that are being starved of oxygen. And one of the very first things that has to happen is aggressive fluid resuscitation. In sepsis, blood vessels become leaky and blood pressure drops, so you have to refill the tank, and you have to do it fast. The standard protocol is to give a big slug of IV crystalloid fluids, specifically 30 milliliters for every kilogram of the patient's body weight. And you've got to get that in within the first 3 hours.
And this slide illustrates something really important. Giving fluids isn't just a one-time thing. Modern sepsis care thinks about it in 4 distinct phases, which you can remember with the acronym ROSE. You start with rapid resuscitation, then move into an optimization phase. After that, you're in stabilization, where you're really careful not to give too much fluid. And finally, as the patient gets better, you move to evacuation, where you're actually helping the body get rid of all that extra fluid.
You know, even the type of fluid you use matters. For a long time, normal saline was just what everyone used. But we've learned that it can cause its own set of problems, like messing with the body's acid-base balance and even hurting the kidneys. That's why today, the guidelines really favor what we call balanced crystalloids, like lactated ringers. They're much more similar to our body's own fluids, and they come with fewer risks. All right, so resuscitation is underway, and we're stabilizing the patient's circulation. At the exact same time, the focus broadens. Now it's a two-front war. Attack the infection itself and provide life support for any organs that are starting to fail. So there are 3 interventions that are the absolute non-negotiable cornerstones here, and they pretty much all happen at once. First, hit the infection hard with powerful, broad-spectrum antibiotics, ideally within that first hour. Second, find the source of the infection and control it. That could mean anything from draining an abscess to pulling out an infected IV line. And third, if the blood pressure is still low despite all those fluids, you start vasopressors to keep that mean arterial pressure, or MAP, above 65. But beyond those initial big moves, managing a septic patient is like being the conductor of a very chaotic orchestra. You have to support every single organ system that's struggling. So that might mean using low-dose steroids for really severe shock, putting the patient on a ventilator to help them breathe, giving blood thinners to prevent clots, using insulin to control their blood sugar, and starting tube feeds early to give the body the fuel it needs to fight. Making it through that initial storm of sepsis and getting out of the ICU, that's a monumental victory. But for so many patients, the journey is just beginning. The recovery is a marathon, not a sprint. And this is the central question for survivors. The infection's gone, the organs are stable, so the battle is won, right? Well, not exactly. The body has been through an incredible trauma, and for many, leaving the hospital is actually the start of a whole new set of challenges. A lot of survivors deal with something called post-sepsis syndrome, or PSS. It can show up in all sorts of ways. Physically, it can mean crushing fatigue and weakness. Cognitively, people talk about memory loss and brain fog, and psychologically, it can lead to anxiety, depression, and even PTSD. This is exactly why having a strong support network with things like rehab, follow-up clinics, and peer groups is so incredibly important to help people get their lives back. Okay, for our last section, let's zoom out. Because fighting sepsis isn't just about what one doctor does for one patient. It's about how entire healthcare systems are set up to prevent infections in the first place and to respond to sepsis way more effectively when it does happen.
So if you want to prevent sepsis, it helps to know where it usually comes from. And when you look at the data, it's really clear. While technically any infection can cause sepsis, lung infections like pneumonia are by far the #1 cause. After that, you see infections coming from the gastrointestinal and urinary tracts.
So how do busy hospitals make sure that every single patient gets the right care at the right time, every time? They use standardized protocols called care bundles. A bundle is basically just a short checklist of proven interventions that, when you do them all together, lead to much, much better outcomes. And the core things you see here, getting that lactate level, drawing blood cultures, and then rapidly giving fluids and antibiotics, that's the playbook for how modern medicine saves lives from sepsis. When you boil it all down, the fight against sepsis is about 2 things: preparation and speed. It takes clinicians who are always thinking about it, hospitals that have these life-saving protocols in place, and a real commitment to supporting survivors long after they've left the ICU. By constantly getting better at every step in that chain, we can keep getting better at winning this race against time.